The next slide is, as I was talking about, there are so many colleagues are there who are doing a wonderful jobs in augmentation. I also earlier was doing the sinus lift procedures, the horizontal grafting, the vertical grafting, taken the chin graft, having taken the bone block from the chin, from the ramus, and it is all successful. The implant is all also integrated. But the thing was, whatever the grafting I have done it, I realized in the later years, there's always the implant was engaged in the native bone. Whatever the augmentation I have done it, the augmentation is all gone. I'm talking about the follow-ups of 5 to 10 years. Right now, my first chin graft I did in 2003. So you can say I'm having a follow-up of more than 17 years for that. But there is only a periosteum is there, a thick periosteum is there. I can really feel that the body of the implant and shape of the implant. So we can say the part, whatever I did with the chin graft is all gone. I'm just sharing one example. And now you can see there's a Cochrane evidence is also there. You cannot actually neglect this Cochrane evidence, or you can deny this Cochrane evidences. And it is like that. Other than the fibula, whatever the grafting we were doing, it doesn't have a high predictability, or it is not that useful, because basically we were anchoring the implant from the cortical bone or from the native bone. Now, always we have been criticized. We say there is no publications available, there is no literature is there. Guys, the literature was available from 1953 onwards. Everywhere the literature was there. Professor Cortico has done a good amount of work, and it's all started from Professor Linkov, Dr. Tremonti, the senior Dr. Tremonti. They were all doing in the immediate functional loading implantology. Our Italian friends, they are all up to now, they're all doing immediate functional loading implantology, and they are doing a single piece implantology. Okay, I again emphasize the single piece implants. So we now, but the evidences, the recent evidences, means when we would, there were, you can say there were two type of thoughts were there in the universities, where one was the Swiss concept and the second was the Italian concept. The Italian concept were all into the cortico-basal implant, they were all into the compression of the cancellous bone. The Italian concept was all when we are talking about immediate functional loading implantology and the single piece implants. And the Swiss concept was to do the grafting and to load the implant, to delay the loading. And after that, when the implant is, the fixture is all healed, then they were loading it. And good number of publication recent years, they have started publishing in the universities, and the story has started about the osseointegration and the grafting protocols, and it was reflected like this. Other than the grafting protocol, nothing can work. But guys, you know, if you want to look of the evidences, the long-term evidences started coming with the single piece implantology. Those were the guys, those were the doctors, the legends like Professor Linkov, Tremonti, Cortico, and now the Dr. Edesa. They were doing the side, like Professor Linkov was operating the implants. They were placing the implants from 1953 onwards. So the long-term evidence, or the longest evidences, if you are going to find out, is all coming from the single piece implantology. And please, when we talk about a single piece implantology means the abutment and the implant is a single piece. So you cannot do a delayed loading when we are talking about a single piece. So they were all doing a single piece implantology, means they were all doing immediate functional loading implantology. Well, there is a difference there between immediate functional loading and immediate loading. Immediate loading you can do, you can make a temporary crown or temporary prosthesis, but you can do only in the anterior section, because anterior canine to canine, we are not supposed to give any contact. But when we talk about the posterior cases or the distal rehabilitation, we have to go all the full mouth rehabilitation, we have to go for the functional loading. So there's a difference there between the immediate functional loading implantology and immediate loading. And yes, good number of you can just go with the legendary book what Dr. Professor Edesa has written. It is Principles of BOI. And recently they have done, the team of doctors of International Implant Foundation and the other colleagues from the Italian implantology also, Italian concept also, they are coming out publishing in English. Earlier they were published in their own languages, so it was not freely available. But they have started publishing in the English languages, and like in Simpladent, you can say there's a logo is there in the Simpladent, and this is written Simpladent.in publication lectures. You can find out the good number of evidences that has been published It's the multi you know